Well, in this week's Cardiology Countdown, we'll begin with the number 3 article coming from Jack. This is a study of pulmonary hypertension and the prognosis and its relation to right ventricular dysfunction. It's a sobering review of the prognosis over a several-year period of patients with documented pulmonary hypertension and right heart cath, looking at the interplay of targeting therapy to reduce pulmonary hypertension and RV dysfunction. They found, fortunately, with the step therapy that about 2/3 of patients had improvements in pulmonary arterial blood pressure levels, and that was correlated with improvements in RV function. But they found that there was still a poor prognosis among some of the patients despite getting improvements in pulmonary blood pressures. And this emphasized to me that this is a very difficult group of patients to manage, and those that really benefit from having specialists who specialize in adult congenital heart disease and pulmonary hypertension as a way to optimally manage this group of patients. At the number 2 spot is a paper in the Lancet that was on the heart protection study with 11-year follow-up, looking at both the efficacy and safety. This was a 5-year trial, showed an overwhelming benefit of simvastatin 40 milligrams versus placebo. Interestingly, then, they followed patients after stopping study medication. Over the next year, patients actually went on to statin therapy so that the rates over the year got to be slightly better than the study drug medication use and equal after about a year in the two groups. They found that there was added benefit that year after therapy where there was still a differential in statins, and then preservation of that benefit all the way out through 11 years with numeric hints of a little bit further of a legacy effect. Importantly, there was no issue with non-cardiovascular mortality or cancer, and so this really reaffirmed the safety long-term of statin therapy. And hopefully a study like this will help reassure clinicians and patients that statins are really one of the best therapies we have in cardiovascular medicine. At the number 1 spot is an interesting paper done from the Women's Health Study looking at the randomization to aspirin or placebo for primary prevention in women, looking at the net benefit, incorporating the modest reduction in cardiovascular events seen in that trial as a whole versus the adverse effects of bleeding ulcers, and incorporating then some of the less severe but certainly present side effects of easy bruisability and hematuria and the like. And they looked at an interesting metric of number willing to treat to tolerate these safety side effects and sometimes adverse effects in order to get one event prevented, and found that in treating very broadly, there was actually no net benefit, and one had to use a statistical model to identify high-risk patients or selectively treat women over the age of 65 in order to start to get net benefit when incorporating some of these adverse bleeding effects. And so I think a very interesting paper that reminds us there's a benefit to risk ratio with antiplatelet therapy and aspirin for primary prevention, that decision is not a uniform one to give to everybody, but one that has to be balanced with the patient's risk and their anticipated benefit. So with this week's Cardiology Countdown, I'm Chris Cannon.